The mood music on this story is changing daily. This time yesterday, the question was, will we be moving to Plan B? The mood music, if you look across the spectrum of the British media this morning, 24 hours later, is when will we be moving to Plan B? Plan B, of course, let's just interpret that, means mandatory wearing of masks in the way that we used to have to wear them in different settings, working from home more, and mandatory social distancing at shops, etc. Do you think that that would make... Supposing that was introduced tomorrow, would this change anything?
Yes, it should, and prevention is always better. So the sooner you act, the better the outcome. We're almost on the door of November, so Christmas 2021 is not far away. So if you really want to do any preventative work, it is now, which is immunize against seasonal influenza and clear messages, which is in crowded places, buses, trains, tubes, restaurants, places where there are lots of people, you need to have your infection control measures in place, which is ventilation, stay at home and work from home if you can, and wear your masks properly. It's not only a question of wear your masks, but wear your masks properly. And I have always been advising since the Delta variant arrived, that as it is more infectious, we should also up our game and wear better quality masks. So I have always been saying wear FFP2 masks when you're out and about.
And if you were to get the call from Downing Street today, this is just a little fantasy here, and you were appointed our new booster jab czar, in charge, sole control, people jump when you say jump. How would you fix this delay in rolling out the booster jabs? What would you do? You've talked about the problem with GPs, we've talked about pharmacists. What would you do to fix it so that this time next week we were up to speed?
This is quite easy, actually, Richard. So I would use what I would call targeted booster vaccine program. And by targeted means I would identify the extremely clinically vulnerable. They are the ones who will maximally benefit from the booster vaccines. So I may not get around to covering everyone over 50. That doesn't matter. But I would target people who are really clinically vulnerable and make sure that they get the vaccine as soon as possible. And because you're targeting, you've got a smaller number of people to immunize. This smaller number of people can be immunized properly, quickly, if you have what I said, a coordinated effort, which is either a task force, set up a hub, or set up visiting teams to nursing homes, care homes, etc.
Before we let you all go, Dave Carr, critical care nurse in ICU. What do you fear will happen if we don't move to Plan B?
Well, what we're seeing already is that our intensive care units and our hospitals are filling up with COVID that's tipping everything over the edge in terms of our ability to deliver a normal NHS service. So what I fear is the waiting lists are going to get longer. People are going to be denied the life-saving and life-changing operations that they require. And I'll tell you this, our staff are absolutely shattered at the moment and they are leaving. And I think the same crisis that you're seeing in the care sector, we are seeing in the NHS. And it's not in a few weeks, it is now. Yep. We are understaffed in my hospital, in hospitals up and down the country, and that is making the job that we do difficult and unsafe for the patients that are receiving that care.
Yeah, and Mike Padgham,
it is turning into a disaster.
OK, Mike Padgham, in the care sector, might you introduce individual lockdowns?
Well, I think that we did that for ourselves before the government told us, because we see what was coming. And I'm seriously thinking today, actually, we might need to do the same, because I don't want to wait until it's too late again, like happened in the first wave, because we know what happened. So we're going to be very, very careful and be cautious. And I ask the public to bear with us if we have to lock down again earlier in care homes.
All right, listen, thank you to all three of you, all speaking from very different disciplines, but all with a toe very much in the water. And I think the collective message that's come out of this conversation today, this morning, is, and if you're watching this, Boris Johnson, which you're probably not, but if you get a chance, it's action this day. As your hero Churchill would have said, action this day. It's time to get on the train.